to be introducing another one of those magnificent geniuses who seem to be proliferating in the world today. The most extraordinary thing that's happened to me in the course of the last year has been meeting with a series of medical scientists and doctors. Really none more extraordinary than the woman in front of me, and I want to introduce her to my network. Her name is Maria Chrysler, and you are very, very welcome.
Thank you, Sasha. My name is Maria. I've been a clinical scientist for over 20 years. So most of my life. I am mostly dabbling in research over the last probably 5-10 years. I've been an owner and operator of multiple medical businesses. So I've been deeply entrenched in, let's say, all facets of medicine and pathology. I've been in on research for human papillomavirus and cancer and virology, and most of my training was down in Colorado Springs. And so I've sort of been all over. I've even assisted autopsy and really gory things like that. A lot of microbiology and hematology specialty type of work, and also immunology. So I would be what you call a pathologist's right hand under the microscope. So anything really under the microscope was my cup of tea. I could grow it, I could show it, I could label it, I could pick out a disease, things like that. So I've got a lot of interest in what's going on here, obviously, and I have some things to introduce to people that are natural that I'm pretty excited about.
Well, I'm very stoked about it as well, not least because I was lucky enough to see a whole series of before and after photographs of the microbial formulae that you're working on. I'm assuming it's microbial formulae. You can correct me there. But certainly we're talking about magic stuff. And I know it's happening. I've been involved for the last 4 or 5 years in vanguard microbial research and understanding how certain things can endogenously create other things, and those things are remediating the systemic poisoning of the human biome. Because essentially, we're made up of microbes, little bugs. It's what we are. We're walking, talking little bug factories. And how we reconfigure, realign, create coherence at that level within the gut biome, the brain biome, and so on, becomes a matter of supreme importance. In fact, it becomes a matter of survival roundabout now, given that the biosphere is weaponized, and given that governments around the world are in a, let's be polite, let's be kind, they are in an unconscious and unwitting conspiracy of planetary genocide. That is clear to anyone amongst my brilliant networks. So we know we are at war with the status quo. We know that the status quo is at war with us. The thing that will determine whether we survive or not will be the degree to which we awaken within that ghastly reckoning and say enough is enough. Agrochemical industries are pure evil. Pharmaceutical industry is pure evil in the main. You could argue that 0.01% it serves humanity, but the rest is systemic poisoning. We know that that's the case. So you're all about remedy, you're all about solutions, and thank God, brilliant people like you have had the know-how. You've launched a product range called VIII. What's the thinking behind the name before we get into the product?
So, Sasha, I'm Native American. I'm a blood-born Apache, and then my mother was adopted by Comanche. And the name signifies green leaf, means green leaf in Native American in multiple languages, right? So there's a lot of crossover there. That's really where it came from. Same thing with the logo, branding, and everything. But we wanted to create an experience for people, so when they open up this package, that it becomes a sense of healing for them, because the products are all natural and literally come from the earth and are cellular in nature, cellular micronutrients in nature. But main focus being trying to get back to reality and teach people the power of their own bodies and their own immune systems, and literally show them on screen what kind of power they have. You know, I think people always reach for a pill. We always look for that quick fix. And I don't know with the assault that we're under, if that's going to be, if we're going to get out of it, right, without Mother Nature's help.
Right. And that starts, of course, with us actualizing our consciousness and remembering the divine covenant between ourselves and nature. I mean, that's a seminal piece of it. And the First Nation peoples, Native American Indians, greatest amongst the First Nation peoples, have always been about that relationship between humans and nature. But look, let's just dive straight in to see some of this incredible stuff. When I looked at these slides, I understood the significance of what I was looking at. And just before we start, I just want to salute you for being alive on this planet at this time. Okay, friends, take a look at this. These are slides, simple before and after. This is the kind of stuff we really want to see, we really need to see. This is fairly innocuous. I mean, presumably that's acne we're looking at.
Yeah, so we want to make sure that we had a natural product. There's some really nasty things out there that people, you know, teenagers go through, and a lot of it has to do with anxiety and obviously facial breakouts. So this individual has cysts, and we wanted to make sure that we had a topical for him, as well as something internal that we could take. This is just a 1 week progression.
Wow.
So we can have that. It's fantastic.
Wow.
And this is a non-compliant teenager, just FYI. Non-compliance, full of testosterone, you know, they don't wash their faces, they don't care, they're just, well, you know, there.
God bless him, God bless you, and God bless your formula. What are we looking at here?
Okay, so this is a type 1 diabetic child. This is a an oral breakout. So this is herpes simplex virus type 1. And you'll see that in the second part of the slide, this is only 2 hours after application. This formulation, you can actually use a sublingual. This is our sublingual feature formula, but it also can be used topically. And you see the progression that goes through 37 hours. This would normally be a week or two long type of ordeal. And this is a 5-year-old type 1 diabetic. And we managed to accelerate the immune response, right, naturally, and get her to where she was in 37 hours.
This is so beautiful. What are we looking
at? It's fantastic. This, at the top left of the screen, if you look at the top left of the screen, this is also a herpes breakout. She had them on both corners of her face. She's a pregnant girl. This is a 4-hour progression in the top left corner, 4 hours. So you can take it sublingual, and then you can apply it topically, very safe, and it's an all natural product. And it got us there in 4 hours. That is a 24-hour progression in the bottom right hand of your screen. And again, you really have to zero in on it to see it.
This is
and you know, the product takes the pain away at the same time.
Okay, I mean, we don't get this stuff anywhere in the traditional medical pharmaceutical industry base. Take a look at this. People, look away. If you're squeamish, you're warned right now. What are we looking at?
This is an autoimmune disease. This is autoimmune pustular psoriasis. This came from a multiple sclerosis patient. I will tell your audience for background that she was in ghastly pain, obviously, but she had been to physicians for about 7 months. And this isn't a knockoff on physicians. They are given tools like steroids and hydrocortisone creams and things like that. And obviously immune suppressors, which is not something you want to do. You really don't want to suppress the immune response. You want to regulate it. So she took our sublingual formula, and she came to us after 7 months and sent me these before and after pictures. If you go to the next one, this is where we got her in just under 4 weeks. So from 7 months to 4 weeks with the natural sublingual product, we got her here, walking again.
That's just...
That is the same product that was used on the oral breakouts.
Okay, very good.
Same sublingual. This is shingles. So this is facial shingles. You can see when it gets up into your eye area, there's a potential of going blind. So it gets pretty scary for people. This patient actually refused medical treatment. She didn't want anything to do with pharmaceuticals. Her choice. I didn't really know her that well, but we have permission, obviously, for all of these slides. And that continues to get worse. Now, this would have been around a 6 to 7 week ordeal for her. Very, very painful. Think of going to the dentist and having no numbing medication as they drill on your teeth, right? So this is the kind of nerve pain that happens. we got her here in 10 days. And I, had I been able to get to her before or when she started getting broken out, this would have been even less time gone by. So she used the topical version of our signature formulation and got her there in literally 10 days versus 2 weeks with no scarring.
Stunning.
Or I mean, versus 7 weeks with no scarring.
What are we seeing here?
This is part of the anti-aging profile. So this is hair growth, right? And this is literally 1 month. This is 1 month after she started the feature formulation under the tongue. So this is why it's so incredible. It's very innovative because it's touching stem cells. It's reversing aging of the cells and stimulating them to divide and protecting telomeres. So you see that her hair is growing. That's 30 days. And that's 30 days.
Yeah, that was my question.
And let me tell you something.
Yeah,
she's on our Instagram.
I thought you were going to say 3 or 4 months.
No, that's 30 days. She's actually on our Instagram as a testimonial because we figure people won't believe it. They won't believe it, right? You can go to the next one. This is a before picture of eczema, a severe eczema case. And yep, hit that one right there. And that's the same patient. If you go to the next slide, you'll see where we got her in 24 hours. And then the one on the bottom.
To that, in 24 hours.
Yes, in 24 hours.
Dear God, that's incredible.
Right, and that's the topical variation of the signature formula. And this is 24 hours later on this one. Yes. And we figured people wouldn't believe, so she's actually on an Instagram live where she gave us a testimonial and a shout out and said, look, this is real. Not only did I stop itching, now I would tell your viewers too, this is an autoimmune type of a disease and you can't just put a Band-Aid on it with a pill or a topical, right? This is an internal problem and you have to go after re-regulating your immune response and fixing the problem from the inside out. So this is a Band-Aid, essentially. This is fungal. So this is a woman's nails just infested with like a candida. And that's before, and this is her after. And that's just a topical formulation. It's a topical antifungal formulation. Mm-hmm.
How long?
Same thing. That was 6 weeks.
Got it.
Right? And it's actually incredible because it's very difficult to penetrate.
Yeah.
Right? And do that naturally, but we got it done. This next one, this is probably our pride and joy. So this is anti-aging. If you look at this, you'll see that tissue is corrected, pigment is corrected, tone and texture are correcting.
Oh yeah.
And we have to rely on people they just willingly send these photos to us, right? We don't solicit these things and they send these to us and say, you're not gonna believe this. Well, yes, we are, that's what we meant it for, but we're always pretty excited whenever we see these changes. This person looks like she is 5-10 years younger.
Yeah.
Right. So what I like to show people is that if we can create these types of changes on the outside, this is the same signature formulation that goes under your tongue. It is a sublingual. So this goes under your tongue, 10 drops a day. Right. And if we could produce these types of results on the outside, can you imagine the positive changes that are occurring?
So
yes, inside the body.
Let me speak.
That was two.
Let me just have a word, if I may. What is the time differential here?
2 months.
8 weeks. Very good. Outstanding.
Yep. Mm-hmm.
Outstanding. Okay.
And then,
those are those slides. Did you want me to show you this small slide? I don't know what that was.
So that's a diabetic Dexcom. One of the patents that we have that are pending on that formulation, one is antiviral, one is anti-aging, and the last is diabetic management. So those are the patents that we have pending. None of this is meant to be necessarily a cure, but we are helping to manage symptoms related to these types of issues that people have, right? By going after and regulating the immune response.
Very good. Just doing a last pass through.
You bet. You bet. Isn't that incredible?
Yeah, remarkable stuff. I mean, for me, all the more remarkable, like I said, because the last 5 years I've been really at the vanguard of meeting with medical scientists, innovators, and microbial biologists and so on. And I've never seen anything as stark as this.
Isn't it great?
I'm just blown away. I love the fact that there's this infinite supply of testimonials now coming through with people whose lives have been turned around. Again, the reason why I'm excited about even being a snake oil salesman and being on the front of really promoting these things. And I say snake oil because back in the day, 150 years ago in the 1800s and 1700s, it was good pharmacologists or good people who were working on remedies who were moving against at that point, the burgeoning medical establishment. And of course, they were called snake oil salesmen, even although it worked and people out in the counties knew it worked. So I regard snake oil salesmanship today to be something, a 180-degree flip from Bill Gates and Anthony Fauci and their satanic agenda. So I am excited about this because I know what you talk about immune system being boosted 100%, you're talking about a saving grace. You talk about being boosted 500%, you're talking about paradigm shift. Now, what is your estimation in terms of the percentile in increase in autoimmune boosting with these formulas?
So I'll tell you what's happening. So I use a plant to access the immune cells, right? To access the receptors on the immune cells, and then deliver the micronutrients and the rest of the products to it. Like and the absorption that we're getting is well over 120% because we're going through a sublingual, right? But it becomes difficult because you can over antioxidize a cell. You can use too much zinc. There's too much is too much, right? You don't want to turn on the wrong pathways, and your metabolic system is very, very intricate. You take one thing or one dose of something and you're going to affect 1,000 other pathways. You have to be so careful, right? So if you take one, you should have some antagonists right on the other side to make sure that you don't trigger cancer or you're not doing the wrong thing. So I always promote everything in moderation. As far as like a percentage of how much are we boosting or regulating the immune response, it's going to vary from person to person. But I will tell you that what makes this so different is that it is using micro dosing. If you want to bring up that movie really quick that shows that cell bouncing around, I think this is important for people. So you see a pathogen that comes down, it's landing in the green receptors down here. Yeah. This is actually pretty cool. If you have even one or two of those receptors that have the right micronutrient or product on them, that won't happen. That will not happen. Your cell is protected from pathogen, just depending on what it may be. And that pathogen has nowhere to go because the cells around it are protected. So your immune cells come through and they're going to take it out and clean house just like they're supposed to. But I thought that was a really cool graphic so that people could see that you don't need 1,000 milligrams of something or 1,800 milligrams of something, because microdosing actually works better.
Understood. But okay, so I'm going to push the point because you're the one who's clinically observing what's taking place, and in your expert view and in your layman's view, what are we typically looking at when we're looking at images like this? And you're talking about that being a matter of 60 days. That is incredible. If you're talking about this being a matter of how many weeks between these two?
4 weeks. 4 weeks sublingual.
Okay, so then I'm able to, even as a layman, say that I'm seeing an autoimmune system being boosted by 1,000% plus easily, hands down, based on normal patterns of observation.
Yeah. Mm-hmm. Isn't it fantastic? It's literally giving people back their lives. There are so many things about the formulation that we could talk about, from asthma to these white eosinophils, these white cells that you have, and the things that it's doing to help regulate and support stem cells. The evidence is anecdotal, but that's what makes it even more powerful because, you know, when you go in and you start to do research, and a lot of your colleagues are going to know this too, and you start to go and you do research, you present an hypothesis and you say, this is what I believe is going to happen, you know, based on, you know, this formulation, this is what we hope to have happen. I'm showing you this is what has happened. Now you get to work backwards, right? And say, oh my gosh, this is why all of this happened. It's already happened, right? So we already know that it works and it's natural and it's fantastic. It's literally Mother Nature and our biology working together.
Okay, so young
Beautiful.
children, babies, people who are very, very old with seriously threatened immune systems, do you have to be careful about dosage with them?
Not at all. Not at all. You don't even have to worry about it. So I'll take 4 milligrams of an isolate to access the immune cells. What a lot of people don't realize is that if you're going to use any type of cannabinoid, it actually can be immunosuppressive, right? So you want to make sure that you're very cautious about, you know, what your purpose is and how you're going to deliver it. One thing that we can be sure of with a sublingual is the dosage always stays the same because we're bypassing the gut and the liver, right? So we have taken a direct hit. So it's much easier for dosing, right? So obviously you'll, you know, 10 drops a day for an adult, 5 drops twice a day, or, you know, for a young child, then you would, which, you know, we have to put all kinds of disclaimers on everything, but, you know, you'll just back it off.
Well, that's the
No big deal.
thing. And anyway, we're moving very quickly into a whole different horizon. We call it the New Earth horizon. You talk about anecdotes. Anecdotal is everything as far as I'm concerned, because it's like boots on the ground is everything. It's like alternative media is everything. Mainstream media is lies. The status quo is pure Luciferic deceptionism and obscurantism. So anecdotes is everything to me. Seeing these photographs is everything. Reading the testimonials is everything. If someone has taken Anthony Fauci's satanic lethal cocktail or was transfected from someone who did, can this product help those people, and explain how?
Okay, so what we're seeing now is that people, and I'll try not to get too complex, but people are having, even if they've been transfected, they are starting months later to have these rising and lowering blood pressures, right? So we know that they're developing autoantibodies to their ACE2 receptors, their kidneys, lungs, heart. Okay, so they're getting all of these fluctuations, and it's a little bit scary because that'll lead to things like, you know, pulmonary arterial hypertension, just, you know, odd things. So what you want to do is try to suppress the immune response while you're delivering everything that the stem cells need, that your, you know, the micronutrients to your cells that they need, and that you're getting access to them. Yeah. Sasha, what's remarkable? We don't use liposomes. We don't use nanotech. We don't need it. No. Is that remarkable? We don't need it.
I love it.
We don't need it.
Yeah.
No, it's fantastic. So there is a fine line, and we are seeing success with people who have been developing fibrosis that anecdotally the chest pain is starting to relieve, right? So we know that the spike protein causes these, you know, systemic fibrosis and does all this damage, and a lot of research coming out right now. So I can tell you that that we do have 2 products, yes, that combination of 2.
Let's walk through this, if you don't mind, before we get into that, just to give some background. So I'll move the slides when you tell me to. Abay2 Naturals, how to preserve telomeres whilst also preventing proliferation of cells, glutathione and polyphenols.
Correct. Mm-hmm. So by proliferation of cells, we mean, you know, you don't want to cause cancer, right? So you want to preserve your telomeres, but if they get to be too long and they don't go through a natural senescent, you know, cell death type of course, that your cells program, right? Your cells program that to protect you. So you want to make sure that that you have your microdosing proper, right? So this is a chromosome, these are telomeres. You go through cell division, and this is a natural process when you have a wound, right? So if you cut yourself, you go through surgery, you have trauma, stress, you know, oxidation, any of that. So your telomeres are nice and purple and long, but as your cells divide, they become shorter and shorter and shorter. So there are a couple of things that support your telomeres, as long as you can get the absorption and you can get the right amount into the cell. So you go on the next slide, and this is, we use glutathione, a reduced glutathione, and this I'm just showing absorption, 10 minutes, 20 minutes, 30 minutes, and this is actually a study that was done by the government and showing oral absorption of a sublingual or a lozenge of glutathione. And this is very important to make sure that your stem cells are supported, and that we have everything else going on, like, okay, neutralization of hydroxyl radicals, which is what people are coming down with post spike protein infection, right? Transportation of mercury out of cells and the brain, very important. Regulation of cellular proliferation.
That's huge. I mean, that affects autism, that affects Alzheimer's on an unprecedented scale as well.
Everything. Vital to mitochondrial function and maintenance of mitochondrial DNA. Very, very important, and directly increases telomerase, extending the telomeres of chromosomes, which everybody in the anti-aging world is trying to do. We want to be younger, but we want to be healthy. We don't want to grow old and be in pain, right? So, you know, the sooner you start, the better. This is a diagram of quercetin. There is a product, there is a product called quercetin phytosome that is patented by another company. What we do is we take, and all you need is a phospholipid. We use a naturally occurring phospholipid. It's a lecithin, and we combine that with quercetin to get the absorption that we're looking for. So we know that we're getting down into the bloodstream. And the wonderful thing here is, and I'm going to point this out to your viewers, you know, Pfizer just came out with their wonderful antiviral pill. That is a protease. It's what we call a protease inhibitor. Quercetin is also a protease inhibitor. So all they did was create a problem and then, you know, give you something equivalent to quercetin to fix it.
Yeah.
Right. Amazing. But this is also a very important, just so you guys know about quercetin, it will actually help support the program of cell death so that, you know, you're not getting cancers, your telomeres aren't going to be too long, right? The whole 9 yards. So it does take a little bit of everything, microdosing to get it done. It's phenomenal, right? This is a comparison of, I know probably your viewers are very familiar with this. This is rouleau versus a normal blood smear, right? And rouleau is whenever your red cells, they don't have that negative charge like they're supposed to. And your interstitial environment is too acidotic. This is a normal blood smear on the right, and something very familiar to me. They've got red cells with nice electrical charges that are bouncing off one another. This formulation is increasing the electromagnetic conduction of your cells, and it is measurable on the exterior of your skin.
I love it. Well, capacitance is everything. Everything.
Yes.
And that, in layman's terms, of my audience, when we talk about capacitance, we're talking about one's own capacity to transcode, transduce light, life force, plasma, prana, chi, without which there is nothing. So capacitance is everything, and clarifying our cellular environment and molecular environment and so-called atomic, the geometry of the atoms and all the rest of it. We're talking about coherence. Restoring coherence comes about through capacitance. So very important stuff. And when you see images like that, that's where you know it does what it says on the tin. So where from here? I mean, we're seeing reverse aging there anyway. Life extension will creep in as a byproduct of health and wellness, and vitality and capacitance. I
will tell you, this is super interesting. In the last 4 years, anytime you have trauma, your cells have to rapidly divide, right, to heal. That's how we heal. Human beings, we can regenerate our cells. But you want to protect your DNA. You don't want your telomeres to get short. You want to make sure that you don't have damage. It is very difficult for us as human beings to live amongst glyphosates, to have poison in our water. We are inhaling graphene nanoparticles 24/7. There's a new quantum phone out that connects to graphene particles in the air and then connects to a satellite. That's how you never lose connection. So I mean, we're breathing these things, right? And we are constantly under oxidative stress. So I tell people, can you imagine the power of your immune system and your biology when you see images like that and you are constantly under assault with poison food, poison water, poison air, and stress and EMF, and we can still show you that you have the power to reverse those oxidative changes.
Yeah.
Isn't that amazing? It's incredible.
Too exciting for words. But to my mind also, 2022 is all, and I've been saying it for some time, 2021 is really the end of this grisly process. We move into a kind of zombie apocalypse right now, which we're seeing, and which incidentally I don't think is a bad thing in the scheme of things. The zombie apocalypse, the breakdown of governments and of banking and of high street and all of that grisly false light infrastructure that we had manufactured as reality, which was never real. It was all part of the grisly, ghoulish, usurious practice of the absence of consciousness, the absence of compassion, the absence of humanity is what led to tarmac, asphalt, pharmacopoeia, the high street, big brands and big bankers and wankers fucking up the entire orchestra of nature for living sons and daughters of God. So given that we're now going through a zombie apocalypse, so to speak, it's a sign of a detox, a planetary civilizational, psychocultural detox that is to be welcomed by the sons and daughters of God. Would you not agree?
I do. Incredible. And the thing is that people, Sasha, people will not pay attention and they won't snap out of it unless they see it. And even then, it's going to be hard for them to let go of the parachute that is, the pharmacopoeia, the magic pill, are you sure, maybe it won't work for me type of thing. But wait a minute, it's your body, it's your mind, it's your heart, it's your soul, and it's your choice. So getting people to let go of that parachute is going to be difficult, but maybe if they see it.
Yeah, well, exactly right. And I mean, you talk about the magic pill and the age of the pill age, the nuclear age was the age of the pill. And that was really the Rockefeller-Rothschild dark covenant, which began more or less 100 years ago. It certainly had, there's a backstory behind it, but about 100 odd years ago is really when the Rockefeller convention kicked in terms of subverting naturopathy, inverting real organic foods, and beginning systemically the business of bringing in artifice and patenting artificial and synthetic molecules, for instance, which have now become the status quo is predicated on artifice, false light, Luciferianism, synthetic molecules, patents, copyrights, all of that shit contained by a global satanic bankster apparatus, which indentures 7.8 billion souls into servitude and into early death syndrome and into lives of misery and trauma and stress, as you would put it. So all of a pain, tremendous pain. So we're now on the brink of restoring ourselves through that thrall of witchery. We are the ones now, courtesy of great innovations like yours and great innovators like you, and yes, you are very clever. Beautiful stuff, man. What to say?
I just want to tell you thank you. My mission here is to give people back their own power. I sit in on Senate hearings. I'm a panelist. I have been working tirelessly, like you, just in a different way, trying to get people to wake up and realize how incredible they are if they just give their body the right tools. right? And I invite anybody to come along this ride with us, and you as well. Yeah, I think it's going to be amazing, and I appreciate you.
And my bad, it's Chrysler, not Chrysler, and I did have that in my brain.
Okay.
So it's Maria
okay.
Chrysler. Do forgive me for that. Yeah, thank you so very much for all that you do and all that you be.
Thanks.